Welcome back to our channel, ladies and gentlemen. There is one question that many people are asking. The country is in a big mess. The infiltration of fake fertilizer into the supply chain. That means that in the next harvesting season, we will not have food. And I guess that is a way of importing. We are creating a channel to start importing GMO. Doctors are on strike and people are dying. If you look at the statistics, people are dying because of the doctor strike. The people cannot afford medication in the private hospitals. The capitation fee for schools, even for the first term, did not reach them. Now they are closing, and when they come back for second term, maybe, just maybe, they will get the capitation for the first term. So everything is in a mess. People are dying as a result of road carnage, and our very dear Murkomen is busy buying very lofty watches. He's very smart and he says he really loves watches. But there's one person who is very quiet as if everything is normal, and that is the chief executive officer of this nation called Kenya, the number one citizen, William Samoei Ruto himself. Very quiet, very calm and collected. And people are asking, where are you? Not physically. He could be in the country physically because I know they were in Ghana. But even when he's around, where is he? Is he alive to the fact that things are in a mess? Because we've had mixed signals. The PS in the Ministry of Agriculture tells us that there is fake fertilizer. And they're doing that, they're investigating so that those who are culpable shall be brought to book. But Dennis Itumbi, I don't know which docket Dennis Itumbi is holding. Dennis Itumbi and the CS in that ministry, Mythical Enthusiast, saying there's no fake fertilizer. These are Azimio propaganda. In fact, very soon they will tell us that people are not dying. Those are Azimio propaganda. Nahumincha says that the people who took the National Social Health Insurance, fund to court are the very people who are now coming up to sabotage the agenda, and that it is a sponsored strike, and that's why doctors are on strike. That position was taken by the government spokesperson Issac Mwaura, and Issac is saying that doctor strike is politically instigated to sabotage the National Social Health Insurance Fund. And when I read this, it's like we don't have a country. The ongoing standoff between the government and health workers is politically motivated. Government spokesperson Issac Mwaura has stated that addressing the press on Tuesday at the Kenyatta International Conference Center, Mwaura argued that there is no other sensible explanation as to why doctors have downed their tools despite goodwill from the government, including the 2.4 billion offer to quell the tension. And he says, it only leads to one conclusion, that there may be political motive in sabotaging the Social Health Act and the universal health coverage. There is no other way you can explain. That is what Mwaura is saying, and is saying maybe there are other forces behind them that just want to sabotage the entire process. We have already given the 2.4 billion. There is money for postgraduate training. We have agreed to negotiate again the CBA. There were 19 issues and they have been classified, 6 for national and 9 for counties. Counties are willing to handle their own issues. National government is willing to handle their own issues. So Mwaura is saying that there is no any other explanation. They are ready to sit down and renegotiate the CBA, something that had been negotiated, and they put pen to paper. Now they are saying that they are ready to renegotiate. If they didn't obey the first CBA, what makes you think that this time round, when they conclude the negotiations on the collective bargaining agreement, then they put pen to paper, that they will respect it? will be the difference between this meeting and the others? And I got this because that has been the position. You build a house by lies, it shall be maintained by lies and propaganda. He's making doctors feel like they are fools. They don't know what they're doing. That doctors don't have tangible issues with them. That the only reason why they can strike is because there is someone who is sponsoring the demonstrations. And the question is, who could this be? Because when Azimio went on strike, we were told that they wanted to sabotage the government agenda, that they wanted the government to collapse. Raila said, okay, let us stop the demonstrations. Farmers are now crying foul of avocado and all the other levies. Who is this person they're saying is still sponsoring doctors to go on strike? I don't think there is anyone, because doctors are people who are learned. They know the issues that are bedeviling that ministry, their offices, and when they work, they know shortage and what they need to do. And when you tell a learned doctor that the only reason why they are on the streets when people are dying is because someone has sponsored them, that is an insult, because you make them feel that they don't know what they're doing. This position contradicts that of Musalia Mudavadi, who is the chief CS. He came on board and he called upon the National Cereals and Produce Board to ensure that they enhance this process, because he said they know the consignment, which one came at what date, on which date, and so they cannot drag and pretend that they go round and round. They should bring those who are capable to book as fast as possible. That was also the position of Rono. It was also the position of Musalia Mudavadi that we should try and move fast to resolve the doctor strike because people are dying. He maintained that we can never joke around with the lives of people. But now Mwaura has taken the path of Nahumincha, that there are people who are jealous of her work. There are people who just want to sabotage. Ladies and gentlemen, we are getting into the second year of Ruto's government. One thing that we must agree is that what they said during the campaigns and they said immediately they got to power cannot be the very, very excuse to date. It cannot be that you still want to blame Raila, you still want to blame Uhuru Kenyatta, because if you ask them very dearly, they will tell you that it is Uhuru Kenyatta. They said Uhuru was sponsoring demonstrations. When the demonstrations stopped, they said Uhuru was sponsoring cases upon the housing levy, case against the NIF and all this. Must we continue blame game? Because I remember it was the same Prime Cabinet Secretary, Musalia Mudavadi, who said, enough is enough. Be that as it may, that maybe we inherited a dilapidated economy. It is time to sit down and work. You cannot continue telling people that, we inherited a dilapidated economy, it is this way. You cannot continue saying that when doctors are on strike, they don't have tangible issues, they are being sponsored. This is archaic and it is outdated. The government must confront the issues before them. That is how governments work. Governments work. When you come and tell your people that this is what we are doing, this is where we have the challenge, but be patient with us. In fact, I believe if you tell doctors that, please, this is what we have done. Number one, we are ready to obey and respect and actualize the last CBA so that the others we can talk about. But you see, when you issue threats, you tell them tutawachisha kazi, then you're not achieving anything. Blame game must stop. Because Raila, they were together with William Ruto in Ghana. This cannot be the very person who is sabotaging the government. Our government is not serious. When doctors hear that there's a lot of money to renovate State House, that the office of the deputy president has used some millions to buy curtains and seafood, what do you think they feel? And the control of budget and the auditor general reveals the wastage in government and corruption, because everyone understands what is going on. And then you still tell doctors that they are going on strike. They have done their tools because someone is sponsoring them. Doctors spent time and money in school, and they took oath of office to ensure that their number one priority is to save lives. When you see them downing their tools, they want to make everything better. You cannot be talking about the national social health care when the very people are supposed to be giving us the health care, the doctors, are not being listened to. That is double speak. You must ensure that you listen to the patients and you listen to the doctors because they themselves interact with the patients every day. Isaac Mwaura must give us a break. We need one communication channel. And we need a communication that is real because we are not blind. We can see what is happening. Let us not allow deaths as a result of doctor strike. Let us not allow deaths as a result of road carnage. Let us not allow the death, academic death of our children because we cannot give them capitation fee. People are busy pocketing money and yet we blame others. We must take care of our citizens, of our doctors. If we want to build a healthy nation, if we want to build an educated nation, let us ensure that we channel money where it is supposed to be at the right time. Everything is in a mess. Even the money that is supposed to go to the counties, in a mess. This is the man who told us he had a plan. The plan is not working. Did we elect someone who did not understand the nature of his job? Is he still planning to plan? He tells us we will stop borrowing. The next day, IMF has given us 150 billion. And you wonder, what kind of doublespeak is that? The president himself once told us that there are shortage of fools in the country. If they still feel that they can hoodwink all the people all the time, they are wrong. Let us not play around with the lives of Kenyans. Because William Ruto took oath of office to protect lives. When you subject people to hospitals where there are no medicine and doctors, you are not taking care of them. Mwaura is wrong. Doctors are on strike because they have tangible issues that they want to be tackled. And now Mincha must understand that when you are given a role, you must be equal to the task. Otherwise, William Samoei Ruto must give us a reshuffle sooner than soonest. And that is my take.